everyone, welcome back to my channel. This is Dr. Duong. Today I'm going to show you how to do cupping for the IT band. If you are a runner, if you lift a lot of weights, or if you're just sitting a lot in general, sometimes the IT band can get really tight, cause a lot of knee pain, cause a lot of hip pain. So I'm going to show you how you can loosen it up at home. We are going to do massage cupping and vacuum suction cupping for the IT band today. So let's get started. For the IT band, it starts off as the TFL and then it becomes the IT band at the top of the hip, comes down to the side of the knee. So sometimes you can have a lot of knee pain, sometimes you can have a lot of hip pain. So for today, we are gonna get this area here. So I'm gonna go ahead and take a towel so we don't get any oil on the shorts here. These out. All right, for the IT band, we're gonna get this region here along. I'm gonna have you turn your feet this way a little bit. That way you can expose the IT band a little bit more. We're gonna put a little bit of the emollient so that we can get some glide with the massage cups here. When I'm putting on the lubricant, I can kind of feel the areas that are a little bit tighter, and those are the areas I'll probably want to work on more too. Okay. So I'm going to start with the larger cup and get the area warmed up, and then I'll go in with the smaller cup afterwards, because then this will be more localized and tell me areas where the myofascial tissue is even tighter. So we'll start with the larger one here. Go a little bit of light pressure. The IT band is super sensitive on folks, so sometimes you don't even need to use a lot of suction to get the benefits and get increased blood flow to the region. And you can see here it's already getting light red. So you can glide along the IT band there, going up or down, or you can even go sideways, cross fibers. A few times here. And then I like to also go in circles. Okay, I'm going to use a smaller cup next. So this one I usually tell patients gets a little bit pinchier, so if you need me to decrease the amount of suction, let me know and we can just go to where it's tolerable. And again, same thing, you can glide up and down along the fibers and you'll start to feel areas where it gets a little bit tighter for them. So down here, towards the knee is where it's tighter for this patient here. So I'll come back to that area and work it a little bit more. But you can see that it slows down. Anytime it slows down or anytime the muscle sucks up into the cup, that tells me those are the areas that are a little bit tighter and that I want to work on more. And then same thing, I can go cross fibers, going sideways. Circles. See this area, I can feel it suction up more. I can give it a little extra pull and then bring it side to side. Helps break up any type of scar adhesions there, helps loosen it up and bring new blood flow to that region as well. Now I'm gonna go ahead and switch over to the vacuum suction cupping to get more suction for the IT band. We're gonna start at the top here towards the hip and then make our way down. So I'm gonna do 2 columns going down. That way I can get more of the front area of the IT band and a little bit of the quad, as well as the main piece there of the IT band. I like to go full suction as long as it's tolerable for my patient. You'll start to see it getting nice and red there. If you're interested to learn about what the cupping marks are, I'll link the cupping mark video down below in the description or up above that you can check it out. There are different meanings for if the marks are red, purple. Sometimes you can get blisters for cupping marks, and in the video I'll kind of explain what all of those mean. So again, IT bands super sensitive for a lot of folks, so if they can't handle the full maximum suction, totally fine, just do 1 or 2 pumps instead, and they should still be able to get really good benefits. All right, so I'm gonna have that sit for about 5 to 15 minutes. I'll see how my patient's doing and then how dark it's getting. If it's getting dark, which I kind of see it is, I'm gonna actually leave it a little bit longer so that it can release a lot of those toxins and a lot of those waste products up to the surface, so that later the lymphatic system can drain it. And then it's okay if any of those pop off, we can just suction back on again. Or sometimes you can use a smaller cup too, because this one's kind of a weird angle, so there's some pieces where there's some gaps there where the air will come in. So we can always switch to a smaller one if needed, but I think I have a better suction on that one now. All right, we'll let these sit and then we'll check back once we take the cups off. All right, after the 5 to 15 minutes, we can go ahead and pop these off. I usually like to start with the ones I put on first. Then release that. Yeah, got some nice cupping marks on him here. So after you release the cups, always drain anything that came up to the surface towards the lymph nodes. So for the IT band, you want to drain it up towards the hip. So at the hip crease, we have a lot of lymph nodes there that will help drain a lot of these waste products that came up to the surface, so it can get rid of it a lot quicker, and so that the cupping marks can dissipate a lot quicker within the next couple days. So we'll go ahead and do a little bit of that here, pushing it up towards the hip. Good, and then I'll just take the towel, wipe off any of the oils here. All right, so that's how you cup the IT band. If you have any other body parts or regions that you want to see get cupping done, let me know. Leave it in the comments below. Don't forget to like and subscribe, and I'll see you in the next video. Bye.